Thank you, Mr. Chairman. Today, I'd like to talk a little bit about reproductive ultrasonography, which is I conducting every day on farms. Reproductive echoes on Wagyu, Japanese black, are not particularly different from Holsteins. However, I think it is very meaningful to talk about what kind of needs are present here in Japan and how producers enjoy the benefits of the latest technology. And it is an honor for me to talk about this to you, veterinarians gathering here from all over the world. Thank you for coming to Japan. In recent years, the price of JV feeders, steers, and heifers 8 to 10 months old have soared and become 1.6 times higher than 10 years ago. For reference, here shows the 10-month-old feeder price of a market on April this year. As you can see, the price varies a lot. The highest is $11,000, and the lowest $5,700, and their difference was actually $5,500. The price depends mainly on the rating or popularity of pedigree breed, weight, and sex of the calf. Beef producers make much account of the sire's estimated breeding value for meat production in terms of marbling and weight daily gain. To raise excellent and expensive feeders, breeders try to respond to the needs of buyers quickly, using in vivo ET, IVF, as well as AI. Early pregnancy diagnosis increases chance of insemination. It is also required in order to follow the trend as quick as possible. We conduct early pregnancy diagnosis from 26 days after AI in monthly reproductive checkup. I show you the movie of early pregnancy diagnosis. Please pay attention to the heartbeat. Here is a fetus. Do you see the heartbeat? No. The crown lump length is 8 millimeter for 26 days and 10 millimeter for 28 days. Next, fetal sexing. Fetal sexing is required. There is a price difference of around $900 in steers and heifers. Sex-sorted semen are available. If the fetus is female, farmers can keep it as a replacement heifer. There is also the choice not to use semen of the same breed after that year. If the fetus is male, it counts to the number of shipments. Also, in order to predict the calving weight, owners want to know the gender. In fact, older farmers tend to avoid big calf breeds. We start the fetal sexing at 55 days of age. We can judge the sex by the distance between this structure called genital tubercle and umbilicus and tail. Head, forelegs, umbilicus, male genital tubercle, which become the penis in the future, and hind legs and tail. Head, forelegs, umbilicus, hind legs, and female genital tubercle, which become the clitoris in the future, and tail. Head, forelegs, umbilicus, male genital tubercle, hind legs, and tail. Head, forelegs, umbilicus, hind legs, female genital tubercle, and tail. Okay, I'll show you some videos. First, day 55, male fetus. Here's umbilicus and male genital tubercle. We can see heartbeat, male genital tubercle, hind legs, and tail. Umbilicus, male genital tubercle, tail. Day 60, female. Head, umbilical cord, female genital tubercle here, head, neck, heartbeats unclear because the cow is panting. It must be a hot season. Umbilical cord, hind legs, and female genital tubercle, and tail. Day 85, male, we can see penis and scrotum. This is penis and umbilicus. Penis, umbilical cord, and scrotum here. Penis, umbilicus. Neck, head, eyeball, and lens. Eyeball and lens, and cotyledon. Day 91, female. We can see 4 teeth and eyeball and lens. This is torso. We can see 4 teeth. Four teeth here. The umbilicus, heartbeat, female genital tubercle, which is unclear, and tail and umbilicus. There are 4 blood vessels inside the umbilical cord, which are 2 arteries and 2 veins. 4 teeth, neck, head, and eyeball and lens. Since the diameter of the eyeball is just 1 centimeter, so if you can remember this, it will be useful for the fetal age diagnosis. Eyeball is 1 centimeter in 90 days. If we can't get a good horizontal section, it is also possible to diagnose by moving the transverse section. Head, penis, umbilicus, penis, tail, hind legs, penis, umbilicus, penis, tail. Next, twin diagnosis. Twins and multiple pregnancies are extremely few compared to Holstein and less than 0.1% in inseminated cows. However, 2 embryos may be transferred in order to improve conception rate. Depending on the owner's request, sometimes we do not administer PGF2 alpha to superovulated donor cow after flush and let it get pregnant as it is. In some cases, I transfer an IVF-JV embryo on day 7 after AI, we call it chasing transfer, to Holstein cows. Twin diagnosis is important in these special cases. Why we do transfer 2 embryos? Because we want to make conception rate higher. It's not for twin production. We will transfer 2 embryos or do chasing transfer for the purpose of increasing interferon tau at the time of maternal pregnancy recognition. In many cases, we transfer with combination of an A rank and C rank embryo. Day 57, unilateral twins with sexing, and we can see twin line. First fetus, we can see twin line here. First fetus is male, here's male genital tubercle, and second fetus, and twin line here. Second fetus is female, unfortunately. First fetus, is male, and second fetus is female, the twin line we can see. The unilateral twin line is often seen by connecting 2 amniotic vesicles like this. Here's twin line and amniotic vesicle, twin line and amniotic vesicle, and twin line. The reason why the twin line looks like that is explained by this hypothesis. The allantoic cavity, blue part, is gradually expand in this way after implantation, first lining the chorion, and second occupying the space lining the amnion after all. First lining the chorion, and second occupying the space covers 2 amniotic vesicles. Due to this time lag, a plane may be formed connecting the 2 amniotic vesicles. Day 49, bilateral twins. we can see called twin circle. First fetus and second fetus, first fetus, and this is not an amniotic vesicle, but an allantoic sac, which is a structure unique to bilateral twins. It's also twin line, so we call it twin circle. This is amniotic vesicle, twin circle, and amniotic vesicle. The bilateral twin line is often seen by a circle like this. This circle is not an amniotic vesicle, so do not diagnose as a triplet. This hypothesis explains the reason for the circle. In a bilateral twin, the Allan tooth gets into an elongated back shape and enters the other side of the uterine horn. If this entry is small, twin circle cannot be found. Unilateral twin line is an essential finding. We can find them before two amniotic vesicles when we performing the pregnancy check, and they are deciding factor of the twin diagnosis. However, bilateral twin circle is not often found. Diagnostic significance is small. As compared with Holstein, JB has less reproductive disorders and higher conception rate. However, since some semens are extremely expensive, they want to keep the reproductive performance well and improve the conception rate. We perform fresh check from 1 month after parturition. Check the resumption of the reproductive organs. If any abnormality, treat it. Productive lifetime of the JB is much longer than daily cows, and more than 10 parities are not uncommon, so care must be taken as older cows. Periodic checkup ensures diagnostic accuracy and also maintains both our and their motivation. Farmers are pleased and grieved by each diagnosis because it is directly linked to their profit. Farmers have no choice but to make management in the current framework, which means the method of price determination and the mechanism of distribution. If so, as a specialist, I want to respond as much as possible to their needs. For that, I want to learn and practice the latest technology. I want to make many calves of latest breeds by making full use of AI and ET technology. I want to listen to concerns and questions of farmers, think together, and encourage them, and I want them to carry out sustainable farm management. The equipment I used is Stringer 50S, a little bit younger than now. That's all my presentation. Thank you.